let me just first tell you how proud I am of the folks that work in our long-term care facilities. Having personally engaged with a number of these employees, they're in a very tough spot, and they're working very hard. In fact, in the last 2 days, I've been in a facility down in Henry County, and today I was in one up in Acworth, and they're really working hard to take care of their residents. With respect to the training that we're providing, the infection control that we're providing, and also the testing that we're providing in support of the Department of Public Health. Every bit of that is at the request of the specific long-term care facility. When we go in and provide training, it's very basic. Some of the things that the governor talked about is things as simple as what PPE do you need, how do you put it on, how do you take it off, and then our recommendations with respect to you come to work in your street clothes, you have a sterile room where you change into your work clothes, and then you go back in there and you put your work clothes in a bag, and just very simple things to prevent cross-contamination. And then we couple that with good infection control inside those long-term care facilities. As the governor mentioned, we've done over 1,200 of those missions. Over 300 of them we've done twice, and we're going to continue to do that until the boss says stop. And we're going to continue to support our most vulnerable citizens out there. With respect to testing, obviously when we see the data that tells us a long-term care facility may be having a problem, that will trigger us to make the call and offer additional support. If they accept that support, we'll go in conjunction with our partners in the Department of Public Health. We'll provide that sample collection. Obviously, that goes back to the lab for testing. But I think it's important to note that these folks in long-term care facilities, the people that run those facilities, had no requirement to keep PPE on hand before COVID-19. So their learning curve was absolutely vertical. And we're not just working for them, we're partnering with them, and we very much appreciate everything that they're doing to partner with us and to help their residents get through this.